The following program is a paid presentation for American Medicine Today and the Bonati Spine Institute. The information and opinions expressed are solely those of American Medicine Today and are not the opinions of the station, its affiliates, management, or employees.
Welcome to American Medicine Today, presented by the Bonati Spine Institute, the world leader in advanced spine surgery, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD.
Hi, I'm your host, Kimberly Bermel, and welcome to American Medicine Today, brought to you by the Bonati Spine Institute. Every week, we inform you about breakthroughs in medicine, educate you about the growing concerns medical professionals, politicians, and experts alike have about Obamacare, and highlight the work of Dr. Alfred Bonati and the Bonati Spine Institute by sharing some of our patients' remarkable recovery stories. In today's show, I'll be joined by my American Medicine Today radio co-host Ethan Euchre as we interview Dr. Randall Latore, an ear, nose, and throat doctor or otolaryngologist working with a less invasive solution for chronic sinusitis by using balloon sinus dilation. Next, we'll hear from Angelo Sapia, a man who visited Dr. Bonati in 2008 that was confined to a wheelchair and he couldn't stand for more than 15 seconds. Dr. Bonati removed screws from a previous fusion surgery Angelo had performed in Maryland that was causing his pain. 6 years later, he returned to experiencing pain and difficulty breathing in a different area that once again was caused by the fusion surgery performed years earlier at another facility. We'll hear from a very grateful patient about his remarkable recovery after receiving the exclusive patented Bonati spine procedures from Dr. Alfred Bonati. In our final segment, we are proud to be joined by investigative reporter and Fox News host John Stossel during our broadcast of American Medicine Today, airing on News Radio 970 WFLA in Tampa. We will speak with him about the growing concerns that we have all about Obamacare and how it will affect all Americans. Finally, we'll be joined by Dr. Bonati to hear his comments about what needs to be done to correct this crisis in American medicine today. Joining me in our first segment is radio and program executive co-host of American Medicine Today, Ethan Euchre.
Thank you, Kimberly. Every Saturday at noon, we are joined by interesting guests who shed light on the growing concerns many Americans have about their medical care. We're also driven by Dr. Bonati's quest to find medical experts who are pushing beyond conventional methods and are finding minimally invasive treatment options.
We are proud to introduce our first guest, Dr. Randall Latore, an otolaryngologist from Florida Medical Clinic. We visited him at his office as he performed balloon sinus dilation.
With millions of people suffering from chronic sinus problems, this segment should be interesting to almost everyone in our audience who suffers or knows someone who suffers from breathing problems.
Hi, we're here with Dr. Randall Latore, and he's an otolaryngologist. Hopefully I got that right. But we just actually witnessed a surgery, a sinus balloon surgery of one of his patients. So, Dr. Latore, how many people suffer with sinus problems?
There are over 50 million patients that probably suffer from sinusitis, what we call inflammation, and or an infection or acute. Mainly, I'm treating the chronic patient, the patient that has recurrent acute infections and needs some sort of treatment and trying to avoid this trip to the surgical arena.
And Dr. Latore, there's apparently 8 different sinuses in the face and in the head. I didn't even realize that you had some so far up in the forehead. What is the purpose of some of these sinuses?
Well, the sinuses are thought to do 2 things. One is to maybe make the head not as heavy because they're actually spaces within the skull itself, so it gives us sort of a lighter weight, but it also works as far as warming and also filtering out air we breathe, which is very important, especially in dusty or pollen-filled environments like Florida.
And we saw, Kimberly, during the process of the balloon treatment, and maybe you can even show folks on the diagram there, you have a guiding light, a tracer light that you called it?
Kind of
something
like
that, an LED light that you put up into the sinus cavity. And with the lights out, you could see it glowing through his head. It was very amazing.
It's pretty impressive when you see it, but just for some basic anatomy, in the typical patient, we have 8 sinuses, but the sinuses that I can treat with the balloon dilation method are 6. And those are the frontal sinuses behind your forehead, the maxillary sinuses behind your cheekbone, and this sinus right in the center of your head, which is called the sphenoid sinus. So essentially the device has a long sort of post that I advance the balloon over, and I use that guide light, which is an LED fiber, to light up the sinus that I'm about to dilate. And literally once I enter the sinus, I advance that light wire, and you will see the glow onto the forehead or onto the cheek, really telling you I'm right in the position and I can balloon that sinus.
And so the patient that we saw today, what exactly were sort of his symptoms and issues? Why was he here? Why was he a candidate?
He's a perfect example of the patient that suffers from chronic sinusitis. And so those are the patients that suffer from constant facial pain and pressure, headaches, chronic postnasal drip, sore throat, coughing. And some of the patients oftentimes complain of dental sensitivity. So when they eat, their teeth are sore. And that's oftentimes just due to inflammation of this sinus along the floor, because the dentition, the roots, actually approach the floor of the sinus. And so they'll feel that sensitivity. And they're the patients that we want to treat because they're not infected. We don't need antibiotics. But now we need a procedure to actually open the sinus to allow two things: aeration and then ventilation.
Let me ask you something though. This procedure, is it just a once in a lifetime thing?
These procedures were, at one point, we used it as a tool in the operating room. What I've done now is taken this out of the operating room to do this in the office without general anesthesia. The patient's awake, as you saw, and it's a permanent procedure. It's not just a quick fix, and then later on we set them up for sinus surgery.
You know, you say quick fix. How long is the surgery?
This procedure itself, and I call it a procedure, and I save the word surgery commonly for the operating room, but this one takes, as you saw, it took 20, 30 minutes to do.
It's fast.
And it actually takes more time to get the patient anesthetized than to actually do the balloon procedure. And if I take that same patient to the operating room, that procedure or that surgery is going to take about 2 hours.
Dr. Latore, you mentioned that you started off in would you call it invasive nasal surgery before? Why don't you tell us how the procedure has evolved over, say, the last 20 years?
When I trained, it was about 15, 16 years ago, we were doing what's called traditional sinus surgery. I don't like to use scraping because we really don't do that. We try to preserve the lining of the sinus and do as little scraping as possible. But that does entail removing bone and tissue using very fine cutting instruments in the operating room. So when you're doing that, obviously, you're going to have more bleeding, you're going to have more scarring and potential infections after that surgery. Patients do great, but the time that it takes to heal is much longer. Patients are out of work about 7 days. I will see them weekly in the office to do a sinus cleaning, so to speak, probably 4 weeks in a row. So it's very time consuming for the patient. So just like everything in medicine, things are growing leaps and bounds as far as technology, and the goal is to become as minimally invasive as possible, yet obtain the same results of traditional surgeries. And that's how this balloon dilation came about. We actually borrowed this from the cardiologists in their balloon stenting of the arteries and just took it a step further for something in the nose. And so now, without having to remove tissue, create scarring, create inflammation, and take the patient to the operating room, we can safely do it here in the office with minimal invasive maneuvers, and the healing is that much faster.
Well, it was pretty amazing to watch and to witness. Kimberly and I were
Thank you.
pretty thrilled to get to check
Yes.
it out.
Great. I'm glad to have you guys. It was a great time.
At the Bonati Spine Institute, all of the procedures are performed here at our 11-acre facility, from your initial consultation and exam to x-rays and MRIs in our on-site imaging center. All surgeries are performed in one of our 3 surgical operating rooms, and recovery is just steps away. This allows the surgeon more access to their patients and allows you to go home the same day. We'll be right back to hear from one of our Bonati spine procedure recipients that have seen remarkable results in our Back to Life segment.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.